From Prevention to Recovery with Marcel Gemme.
Welcome to From Prevention to Recovery. I'm your host, Marcel Gemme. Today I'm joined by someone who brings a truly unique perspective to the world of addiction and recovery. Susan Chubbs spent 9 years working inside a rehab facility, gaining first-hand experience with what recovery really looks like from the inside out. She then transitioned into private consulting and online counseling, where she now works directly with individuals and families navigating drug and alcohol challenges. And she also helps connect Canadians with the right options when they're ready to take that step. What sets Susan apart in her integration of natural health into her approach, recognizing that healing the whole person, body, mind, and spirit, is often what makes recovery last. Sue, welcome to my podcast.
Thank you, Marcel. It's a real pleasure.
Cool. So, can you walk us through your journey into this field? What drew you to work in addiction and recovery in the first place?
Wow. Okay. Well, again, number one, I've always been a person that helped people. So I worked in elderly homes for over 20 years, and I was working in that time into an elderly home. And a lady I went to school with, she wanted me to come and work with the treatment center that she was at. So I actually kept saying, no, 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 I like what I'm doing. I'm helping somebody, blah, blah, blah. And so I decided, hey, I'm going to give this a try. I've never worked in a treatment center. I've never worked with addiction before. So I went and started working there and never looked back. That was
that's
the
good.
point right there. I never looked back because it's the best thing I've ever done with my career.
Awesome. Now, you spend 9 years inside a rehab facility. What does a typical day look like in that environment? And what did that experience teach you that you couldn't have learned anywhere else?
I learned that a typical day is that you never know what's going to happen.
Totally agree with you.
You do not know what's going to happen from the moment you walk in and when you're going to leave the facility. There's times that you can walk in and the day is just going along great. You have your meetings, you check on every individual, the students that were at the center. You had to make sure that staff were doing what they needed to do. You had to be there comfortably with your staff as a team and the people that you were helping. What I have learned from there is a lot more passion, understanding, listening, and more communication. I've had these little skills, but I've really put them to work when I got there because I had to learn how to do that in the right way. That itself was the biggest thing that came out of it, was the passion, compassion, empathy, and a no-nonsense individual. I was a no-nonsense because I was there to help people. I wasn't there to make friends. I've seen it. I've been through it. I wanted to make sure that people were getting the best service. And the best service is when everybody as a team were doing their job.
Yeah. And I think the quality that you mentioned, you need to have them to work in a rehab facility,
Yeah.
wanting to help and so on. Absolutely.
You got to have willing people that want to help somebody to better their life. Like if you're there just for whatever other reason besides that, I'm sorry, that's not the job for you.
Absolutely.
It takes a certain person to be able to handle all what a person's emotions, ups and downs are going through in order to get them through it. And
Yeah.
that is the training that the team had to have. Because if you didn't have it, like, why are you there? Why do you want, that's my viewpoint. That doesn't mean that's what they thought, but the team that we work with loved what they were doing, and they were there for the right reasons. And that's what made a great team.
Now, you work in a co-ed rehab setting. What are the unique challenges that come with having men and women in the same program, and how do you navigate them? By the way, everyone, Sue and I worked for several years together. So
Yeah,
sometimes if you see some smiles on our face, it's because we
we know.
we know absolutely.
The fact that it's like a Romeo and Juliet, you can take it from there. But the bottom line is, it's not that when you have men and women together, and when you're coming off substance, whether it's alcohol or drug substance, the real emotions come out. Whether it's upset, love, whatever, nobody stops a person from liking another person. But when you're in treatment, it's not the timing, because these emotions, whether they feel that it's real, and it can be real, but it's not good for their recovery. That's what we have found, and we have a lot of experience with co-ed. I actually, coming out of it, and working in this field, I much prefer, male or female centers. Co-ed is okay too if somebody is not out to seek something else besides recovery.
Yeah, totally agree with you on that one.
Yeah.
Now, you integrate natural health into your approach to addiction recovery. Can you explain what that means practically with someone struggling with substance use?
What I have found from working in a facility that was not about prescription medication to get off drugs or alcohol, it's I've learned that um vitamin therapy and naturally being in nature and taking walks, all of these natural things are more beneficial to the body, mind, and spirit as an individual than any chemical prescription drug. I can say that, and I will say it till the day I leave my body, because I was never a medicator in my life for myself personally, but that's my personal preference. I've seen many people suffer through medication, and I like the fact that the vitamins, and people noticing that the vitamins help them a lot. I've watched people change from a first point of entry to coming out of the first step of the program with vitamin therapy. It was night and day. It was night and day, and I implement it always in my life. But I also, when I'm on this part of my adventure, is that I talk to people all the time about vitamin therapy. I recommend vitamins. It's always a suggestion. I can never tell anybody you have to do this, but I always recommend it, and people are very willing to take the advice of vitamins. And I've had a lot of feedback of, thank you, it helped. So that's my natural health, and I learned a lot more and more every day from somebody that take different things, and that's it. Natural health is a good thing because it's good for the body, it's good for you as an individual, and it's good for everybody around you.
And also, the fact that, in like the lifestyle of someone using drugs, the lack of vitamins, nutrient, and so on, it's crazy. So
Well, that is 100% true. It's they burn it all up, and they're deficient in the body, and they don't even know why they're feeling this way or why this is going on. But, getting the body healing from the inside out is one of your key things, because you can't see what's going on the inside, but you got to work on from the inside out. And people do feel better when they start taking vitamin therapy. I mean, they can go what I suggest they normally take, but after that, once that's to a period of time, then they can cut it back and they can but they start feeling better. They always notice how much better they feel.
Now, there's often a gap between what people expect rehab to be and what it actually is. Based on your experience, what are the biggest misconceptions families or people in need have when they're looking for help?
People are afraid that they're going to be locked down.
Mm.
That is one of the biggest things I hear, that it's not going to work. These are misconceptions. My biggest advice to any person, and I will say it because people ask for success rates, people ask for this. I always say you can't ask a person for a success rate because you, as the individual who goes into treatment, it's your success with the help of a team. It's where you want to go. What is your goal? Because you're in that bubble in a treatment center. Everything is peachy. When you go outside of that treatment center, it's now implementing all what you have learned. But it's not just even that. You go further on that, it's staying connected to more intelligent, like-minded people as yourself and getting that support, whatever that support is for you. But the environment has not changed. You have to change everything that's in there because you're the one who changed, who came out of treatment. Now you got to either adapt or the environment adapts to you, one or the other.
Yeah, no,
So I
absolutely.
always say to people when it comes to us, what to expect. Well, you're going to expect a schedule of getting on with life. You have schedules. Well, in real life, you have a schedule. Taking care of yourself. People don't take care of themselves if they're coming off drugs or they're on drugs or alcohol. I didn't do that when I was going through the demise. The other thing another big conception, it costs too much money. It costs. I mean, it can cost. There are two options they can have. I give them that. The other option is investment. You want to invest in the stock market or you want to invest in your future. It's one or the other. You can invest in yourself and be proud of this is my investment. That's how I see it. And I say that to families.
Yeah, totally makes sense. Now, as an online counselor, how do you build genuine trust and rapport with clients you've never met in person, especially when they're maybe in crisis?
Marcel, that's one of the most proudest things I do on this, what I do, is I can build that trust because I have an ear to listen. I acknowledge them, I hear them, and they are felt heard. When I listen to a question, I go in and ask the question, but I put it back on their plate, ask them the question. I never make them feel that they have to do something because I don't tell them, you have to stop using drugs. You have to stop using alcohol. I always want their willingness to communicate, first of all, because number one, I mean, there are people that don't want to talk to you. I say, okay, but I have to build a reality with them. The biggest thing is I can build that reality because I have worked the field. I've been in the situation myself. So that's where the trust comes in. Not with every single individual. Some people may not even care, but they don't want to talk to you because they want to reach out, but they just want to reach out. But families are the ones that I have to coach sometimes to get them to ask the right questions. Stop being angry with them. Also, ask them the right questions. Get the right wording in there. Instead of saying, you got to do this, are you willing to do this? could I help you in some way? It's all in the wording. And family members, when they hear that, they say, God, I wish I would have done that before. Or I could, you know, people are writing down exact words I'm saying because they never heard that before. So it really is the real listening of everything, having a rapport with the families and getting them to understand the enabling. If they're an enabler, you're contributing to their demise. You got to be straight, honest, and with empathy that the fact that this has got to stop. Because if you don't stop it, and people talk also about, you got to hit rock bottom. I said, well, you're talking to me, and I don't like the word rock bottom because it's different for everyone. Just because the person is not have all the willingness to do something with communication, with a bit of a push, you can get that person to say, yes, I need. But it's all again in the wording. You don't have to walk on eggshells. You just talk straight, but with compassion
Yeah,
and
totally.
understanding.
And, like waiting until they hit rock bottom can be fatal. So, not
It's
a good
different
idea.
for everyone.
Yeah, yeah, absolutely. Now, what are the most common reasons people reach out to you before they're ready to go to rehab? And how do you work with them during that stage?
Well, one of the reasons people, because they're looking, reach out to us is because they're looking for options. They're looking for a detox. They're looking for treatment centers. They're looking for places that, oh, I can't go to treatment. So what are the options? So it's all about options they're looking for. They can't find it. It's hard to navigate the internet sometimes when they're looking for help. So calling us is, I think, an awesome thing to do because I have the time. Like it doesn't matter how long it takes to help somebody. It's the fact that one person at a time, be there with them. So navigating what's going on with the individual, doing an assessment of what they're taking, how long they've been taking it, and what are their needs, what is really happening with the person. Are they willing to get help? Are they not willing to get help? Do they need an intervention? There's many, many questions that I would ask the family. Now, we don't always get the 100% truth from the family because the
Yeah.
families are desperate. Going back to what is needed, um, is that trust. And I build that trust. I build that trust by knowing this. And that's the feedback I get. I've never heard anybody who's been so helpful. And I know that because one thing I know is behavior and addiction. And that's my knowingness, and that is what's real to me. And that I bring it to families by understanding.
Yeah, totally makes sense. Now, you help refer people to rehab in Canada. What are the key factors you look when matching someone to the right facility? And what questions should family be asking when they call the center?
Helping somebody find the right center, I have to ask all the questions. What exactly are their needs? Or is there any disabilities? Are there, I have to ask all these questions, and I have to look on my list and find out, okay, which center would be the right fit for that person? Um, Sometimes they may not think that's a fit, but I really look at everything. I look at how natural they are. Like, are they about abstinence? Are
Um,
they about, you know, I'm going to say the word out loud. Are they about drugging you? I'm not about that. I won't send somebody to a place that is all about drugging. Not my cup of tea. It's my integrity, and I keep it high. So, families asking the centers, I get them to ask some key questions like, what do you do when you do medical detox, or like what is the protocol for detox? If somebody is coming off some prescription drugs, I get them in communication with the nurses there, or some kind of medical staff, to put a plan together so that they feel comfortable that this is the plan. I'm in communication with somebody trying to come off a medication, and this person is very happy with the center because of A, B, C, and D. Everything is in line. So it's key that the person because once it's out of my hands, you know, uh, it's in somebody else's hands. I don't have that control. It's not because I'm trying to control the people, is because I want to make sure that they get a good service. And their first experience is with me, and then their second experience is with the person at the center. So listen carefully what people have to say and ask them questions. What questions do you have for yourself? Because if you're asking me questions, then you will have more questions for the center. So I get them to ask the right questions.
Now, Canada has both publicly funded and private rehab options. Can you give our listener a realistic picture of what's available and what are the differences in terms of access and quality care?
I'm glad they have public programs out there. I just wish that people could have more access to talking to public program people, somebody in the public sector, because it's too long to wait. And I know this because I've been on this line for 12 years. I try myself to even call all the government resources lines across Canada so that I can see, okay, what exactly does this person have to do to get into a treatment center? I know all the basic things they have to do. So I give them the enlightenment of what this is the option. Here's the government, right to the time that they call and say your bed is available. With that, the care, I mean, I can't say for all centers, but I can say from experience of listening to other people calling me, I don't have to agree with everything they say, but I hear them say, I got kicked out. Okay. There's their reasons for being kicked out. But the bottom line is, if you do something not okay, it's here's your wallet, out the door. Next. That's the motto I'm hearing all the time. I don't like it because, yes, there's many people that need help. And some people, when you're coming off drugs, the emotions are coming up. Nobody knows what emotion that person is going to have. He might have an upset, an anger, way happy. But the fact is, that's real emotions that are coming out. And that's where the people in the government, I don't know if all understand. Maybe we shouldn't really say that, but it's a different care because you're not paying for the program.
Yeah.
You're getting a free service. You get what you pay for. But again, there are many people out there who are succeeding from the government program, and we need to acknowledge that.
Yeah.
So there are people that really, really do want to help individuals, whether government or private or somebody who's working from home. There are people out there. I do prefer the private sector because I want to hold them more accountable.
Yeah, no, I agree with you. And also, like a few years ago, we called like all the public centers, and the waiting list was like 4 to 12 weeks.
Yep.
So it's really challenging also for a mom, that's been trying to get his son to rehab, and then he's ready, and in
Well,
two
this
months.
is the problem
So
we're coming up with is people are ready right now, but they cannot get in or even into a detox because of the waiting time.
yeah,
Families are losing their kids. And I know that because we don't always get good news when we do our follow-up.
yeah,
We don't always get good news. Families are losing their kids because they can't get into treatment, and not everybody has the financial means to get into a private sector. So they're losing their kids. And people are angry because they can't get in now. And when the person themselves who was wanting help and they say, I'm ready now, I melt because I stay on that phone and do everything I can because I know what the public sector got to do. I said, you stay in communication. You call me every day until you get into that detox. I don't care. Just call me. Stay in communication. I do my best, what I can do, even if somebody can't get into treatment now.
Yeah, no, absolutely.
I
It
will
is.
give them other resources as well.
Yeah, yeah. Now, from your experience, who should attend a short term or a long term treatment, and which one would be the most suitable?
I think that's a hard question because you got to be able to, an individual who has something light. When I say light, it hasn't been for 5, 10 years of abusing substance, whether alcohol or drugs. Maybe a short term, for me, a short term should be a minimum 45 days. That's my viewpoint. Minimum 45, but they're 30-day programs, but they designed this because not everybody can stay longer. So longer term people, I mean, in the government, they have 6-month programs, they have 2-year programs, they have a year program. These are individuals that have long-term substance abuse. But does that always help staying in a rehab for 1 or 2 years? I don't think so, but that's me.
Mm,
Um, People looking at a 90-day program, whether it's government or private, I think that's long term. I mean, you got longer term, but it's time for that person to now take the skills they have and start using them. So to answer your question, that short-term thing, I don't know what if you're considering short-term. For me, I know what 30 days.
yeah, about 30 days. Yeah.
30 days, I can tell you there might be a percentage that a person is succeeding after 30 days. I don't know what that percentage is, but I can tell you it's not enough.
Yeah.
It's not enough. 60, 45, minimum 45, 60, 90 days is where you're going to get the real help.
Yeah. No, I agree with you. And just, to start thinking clearly, when you have used for years, takes a few weeks just to think clearly. So,
Well, it does because, just somebody wanting to go into a treatment center for marijuana, and we've had many people needing help for marijuana. It takes 30 days for it to come out of the body if the
yeah,
body's in pretty
exactly.
good shape. If it's in not good shape, it takes longer.
Yeah.
But you got to heal. You got to heal. You got to stabilize. You can't just walk out of a treatment center, my viewpoint, after 30 days and say, I'm done. You're not. I will tell a family, you're not. There is so much more work to do after you come out from there, no matter if it's government or private, you have the work and you have a responsibility to do that work if you want a future.
Totally. Now, in your view, what elements are absolutely essential for a rehab program to truly set someone up for long term recovery, not just short term sobriety?
The constant being in communication, whether it's a year, but it's a responsibility. It's not just a responsibility from the rehab center. Giving them life skills so they can have can they apply these skills that they have been given in centers, whether government or private? Can they apply these skills? If they can't apply, then they need to work on applying them. Why are people succeeding out there? Because they're applying. They're staying with they're being involved with the community, or they're staying in communication with their counselor.
Yeah.
They change their environment a lot of times. Not everybody can change their environment, but they have to look at it differently. They have to have a life change. And that means everything in their life. I'm not saying change your wife or your husband or whatever. I'm
Yeah.
saying change, life change. It's a it's a thought process of, okay, I know this. Now I have to apply it. Myself personally, working with individuals and giving them the life skills and tools that they can have. And sometimes it doesn't always click just like that. A certain incident might come up and they say, oh, and they have me in the background of their head saying this. So it will be applicable when the situation comes. For me personally, I always stay in communication. I'm still in communication. I even have a guy who is writing his own book on his experience. And I've read his book and he is very intelligent when it comes to, but this guy never thought he would be able to apply what he's learned, but he's
Mhm.
always applying it. And he doesn't even realize because it's so basic that it comes natural.
Yeah. Yeah.
It will come natural, but it takes the time because it's not just 5 minutes and you're fixed. It's a life experience change.
Yeah, it is. It is. Now, natural health and holistic approaches are growing in recovery circles. Now, what does the research or your personal experience tell you about their effectiveness compared to more conventional approaches?
More and more people are willing to not be medicated.
Mm.
I'm hearing this myself. This is not just me saying it. This is others saying it to me. Um, they don't like the effects of the prescription medication, so they prefer the natural health way, whether it's taking a walk, whether it's taking a multivitamin or extra multivitamins. The conventional way, I mean, as we have seen it in the past, I mean, in the past few years, is more and more people wanting to go the natural way. We don't have a lot of natural facilities. We have more conventional
Mm.
way, but people have to stand up and be counted and say, I don't want that, or ask them if they can bring their own vitamin therapy with them. There are many No, let me rephrase that. There are facilities that I have implemented a vitamin program
Hmm.
therapy myself. They're willing. The centers were very willing, especially in the first 10 days to 1 month. They give them vitamins if the person wants it. You can't force the person to take vitamins, but instead of prescription medication, if that's what they want. And you're seeing more and more of that.
Yeah, there's more centers, right?
There's beginning to be, but, it's still the conventional way, but
Yeah.
it's because that's what they know. When I say they, I'm talking about the centers, the
Yeah.
medical people, yeah.
Now, what do you find are the biggest barriers for Canadians seeking addiction treatment and what needs to change in the system? Either public or it doesn't matter. Yeah, in general.
The biggest barriers, right, I can say in present time or even in the last few years is, navigating how to get the help, where to call. Um So when you have somebody like myself or drug rehab services, you have people who want to help navigate the right options for the individual. And the barriers could be finances.
Mm.
The barriers could be can't get a hold of the person and or they forgot or they never had a ride to treatment. There's many barriers. And every barrier, if I don't know the barriers for them, I can't help them, but I've helped many people jump over every barrier. I mean, I've got a person from a library on the plane to a rehab in one day because I wasn't accepting. You can't do this, you can't do that, you can't do that. So I had to jump over every single barrier with families and make sure I make things go right for that person. But the bottom line is the barriers can't get in right away, public,
Mm,
financially, for the private.
absolutely. Now, for someone listening right now who is either struggling themselves or watching a loved one struggle, what's the one piece of advice you would give them today?
Just don't give up. Just don't give up. Um, Call us to learn how to talk to your loved one, because it's talking to your loved one when there's a family with somebody in them. When there's somebody in the family and the family are upset, they don't know how to handle it, they're angry, their emotions are high or low or whatever. The bottom line is because they don't know how to help their loved one, or they don't know how to help themselves. Call us, call somebody that will be willing to just sit there and listen and acknowledge what's going on so that you could be guided.
Yeah.
If you can't get into a government program right away, then I'm here. I can talk to you every day. I am not worried about that. What I do worry is that person goes off my line. I don't know what happens sometimes.
Mm,
That for me is one of the hardest things, because that person comes into my space. I call them back. I call the family back, and sometimes it's good news, sometimes it's bad news. These are the things that I want to tell families. Don't enable them. That's a big thing I have to let the families know if they're an enabler. Do not enable. Do not be a part of their demise, because you know what happens if you start doing this because of, I want to help. You think you're helping your loved one, and they're bringing their home, and you think you're safe there. No, you're not. So don't enable. Don't give up. There is help. There are people that really want to help you to help your loved one. Just don't give up
yeah.
ever. Because if I
Absolutely.
gave up, I will not be here
Yeah.
to see my own grandkid, and I know that.
Yeah. Yeah. And also what you said, the coaching is so important because people usually makes the wrong thing, period.
Well, I hear it
Yeah.
all the time, Marcel. I hear it every single day that they don't realize talking to their family and getting mad at them is not helping, because they know there's a problem. The individual who has substance abuse know there's a problem, but they don't want to be told. I said, when I talk to the person who has the addiction, and I say, "Aren't you tired of everybody telling you what to do?" "Oh, yeah. Yep. So tell me what you're willing to do." And nobody
Mm,
ever asked them what they're willing to do. They always being told what to do. I know that. That's 100% reality with me. So when I ask, what are you willing to do? What do you want to do? Then the answers come out.
yeah.
Some people call and say, I think I have an addiction. Well, that's right up my alley. When somebody tells
Mm,
me they think they have an addiction, and by the end it's like, okay, I don't say you have an addiction. I say, okay, is there an addiction problem? Yes, because you asked the right questions.
yeah. And also that's their decisions.
It is,
They
because
voice.
it's
Yeah.
all going back to them, the
Yeah.
question.
Yeah, absolutely. Now, what does your consulting or counseling work look like going forward? Where do you see yourself taking this mission over the next few years?
The next few years, our hope is to help more families. I would like to go out there and do drug-free withdrawing.
Mm,
That's what I would like to be a part of our group, because there's not just me, we have a small group, and I would like that to go forward along with the counseling. When I say counseling, we look at coaching, giving an individual counseling, coaching, but giving the individual the life skills, the know-how, the understanding, so they can apply to their personal life and help themselves. So within the next 5 years, I hope I can help as many people as we can.
This is awesome. Now, if someone in our audience needs help or wants to learn more about your services, can they reach you?
Well, they can reach us at our website. They can go on www.drugaddiction.ca. That's our main ARC services, which is addiction referrals and consultation services. They can also call us at 1-488-488-8434. It's myself and my colleague, Mark. Mark works on the weekends.
Mhm.
I work all during the week. And we'd be delighted to help someone.
Awesome. And we'll put it in the transcript.
Oh, okay, cool.
Cool. Hey, Sue, that was really, really fun to do with you. It's been, we've known each other for over 20 years, helping thousands and thousands of people. So it's
I
really awesome.
love this. I love this work. I've never thought I would be the person to do this work myself.
Yeah.
I mean, you can cut all this out, Marcel, but I never thought I would be the person to do this work myself, but I live for it.
Yeah.
I live to help with addiction because there's such a stigma out there. And people are good. People are basically good.
Yeah.
I never thought I was good. We do bad things, but I never thought I was good. But I am good, and
Yeah.
people are good.
Yeah. No, absolutely.
Okay.
And, this is funny because sometimes people ask me, so when are you going to retire? What does that mean?
Yeah, when
I do what I love and I help people. So,
well, that's the thing,
yeah.
people, and another thing, this is my viewpoint, and people get very like, wow, never looked at it like that. People have always asked me, "Are you in recovery?" My answer to these people are, "No, I'm not in recovery. I have recovered."
Yep.
That blows people's mind. Why have I recovered and they're still in recovery?
Yeah.
It's a viewpoint. It's a decision. And I always tell people to take fear out of their equation, because if you don't take fear, you're always worried about that relapse, 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 relapse. I was that person. So the bottom line is, after 33 years, taking fear out of the equation and learning about myself, about what I have done. It's not about what you have done, it's what I have done.
Yeah.
And taking those tools and bring them forward to help somebody else. Bottom line,
Yeah. No, absolutely.
people helping people.
Yeah. Thank you, Sue.